Hello. This is Super Lab. My case has evolved from last week. And I have a physician order to go for my patient right now. So, physician has the order is azithromycin, zithromas 500 milligram, IVPB now. Patient's name is Fatima Safar, date of birth 0630 XXXX, MRO is 10725811578. So, patient has no known drug allergy. So, the first thing I'm going to do is to compare the physician order with the MARO to be sure that I have same patient, same order, and so now, patient's name is Fatima Safar. Date of birth is 0630 XXXX, 0630 XXXX, and the MRO number is 10725811578. 10725811578. And then the order is azithromycin 500 milligram IVPB now. Azithromycin 500 milligram IVPB now. From the MARO patient already has normal saline at 10 ml per hour running. I can see it here too, normal saline at 10 ml per hour running. The patient has no known drug allergies. So I have this, been able to check and confirm. And so this is my MA, so I'm going to go ahead and pull up my medication. This is my P6. I'm going to go ahead and pull up my medication, do my med checks, and walk to the patient's room. So now, first, the medication I'm administering is azithromycin 500 milligram IVPV now. So I'm going to confirm patient's name Fatima Safar. So this is my medication, azithromycin 500 milligram. Expiration date is 12/31/2030, so it's unexpired, it's intact, and it's sterile. So I'm going to do my first med check. I'm going to compare this with this. So I'm going to go azithromycin 500 milligram IVPB now. Azithromycin 500 milligram. 500 milligram. Expiration date is 12/31/2030. Product is unexpired and intact. So that's the first check. So I'll go ahead and do my med math to know how I'm going to give.
Okay. Okay, so we have our central line dressing kit. It's sterile, unopened, unexpired. And we're gonna fill up the sterile field here. Open it.
So from the calculation, I'm giving the whole of 250 ml because it contains the 500 milligram of azithromycin. That's my first med math. So I'm going to go ahead and do my second med check to confirm. So this is azithromycin, zithromas, 500 milligram. Product is intact and is unexpired. Expiration date is 12/31/2030. That's my second med check. And then I'll do my second med math. So I'm giving 250 ml from what I have here. So that is my second med math. So I'm ready now to go ahead and take this to the patient's room. So I'm going to be using so my patient's hand fell off. Well, then I'm have to fix this.
That's okay.
All right. So I'm going to be making use of a secondary line. So the secondary line is right here. It's intact, it's unexpired, and it's sterile. It's still in the pack. We're assuming it's still in the pack. So the secondary line is right here, and this is what I'm going to use, intact. So let's go to the patient's room.
Next,
Hello, how are you doing today? My My name is Christian. I'm a student nurse at the University of Kentucky. I'll be taking care of you today.
I'm gonna drop our items on
I
our
was
stair.
here to see you 2 days back. I'm going to continue my care. Okay, so how are you doing right now? Patient said she's doing all right. She's doing all right. So could you please tell me your name and date of birth? So, Safa Fatima, date of birth 06/30 XXXX 30 XXXX. My number is 107 258 157 258 157.
I'm gonna check
So I've been able to
my
identify my patient.
which is here.
I would go ahead
It
and
is
tell my
unexpired,
patient
unopened, it's
to tell
intact.
me
The date is,
to check for the level of consciousness of my patient. Like, do you know where you are? Do you know why you're here? Could you tell me what time of the day we are? Patient answer everything. Patient is alert and oriented. Times 4. I'll provide for privacy. Wash my hands. Okay. Then, I'll also go ahead to ask patient if he has any allergy. Are you allergic to latex or are you allergic to any medication?
Now that
Patient already put in the patient chart, there's no drug allergy, so I'm just trying to confirm that patient has no drug allergy. So, been able to do that. So, I'll go ahead and do my last med check right here.
we're going
So.
to grab
Azithromycin. So I'm going to confirm the name first. Safa Fatima, and Safa Fatima. Date of birth 0630 XXXX. And then the medication is azithromycin, 500 mg. Now, I'm to give now. Expiration date is 12/31/2030. So I've been able to do my 3-med check. I'm good with that. So I can pull this out now. So I'm administering this medication. So first thing I'm going to do is to tell the patient what I'm doing. So I'm going to be, because of your infection, it seems to be becoming worse, and so we would want to give you an antibiotics. The name of the antibiotics is azithromycin. I already checked the compatibility between azithromycin and normal saline, and I realized both medications are compatible, so I can give them together. So I'm going to be running these as antibiotics. It will help take care of the infection that you have, and within some few days we should be ready to check your blood culture again to be sure that you no longer have any sort of infection. Do you understand what I said? Patient said yes. Do you have any question for me? Patient said no. So I'm going to go around and do general survey. Like, I'm going to check the environment, make sure the bed is in the lowest position. I'm going to check if the aisle is clean and clear, which it is. I'm going to check if the patient is I'm going to check the patient demeanor. I'm going to check the skin coloration and the dress of the patient to be sure he's well dressed for the weather. Check the posture of the patient to see if he's well aligned, if the neck is well positioned. So that involves general survey, and I'm going to check if the general survey everything is okay, and I can see that everything is okay. Call light is okay. Patient's posture is upright and the hands behind the side. Motor skills move deliberately, and IV fluid is running. And so that is it. So now I'm going to go ahead and check what the patient has running. So I'm going to bring up the map. So it's expected that the normal saline should be running at 10 ml per hour. So I'm going to check. It is running at 10 ml per hour from the. So I've already confirmed that. So I'm also going to confirm if we have normal saline here. So we have sodium chloride, normal saline. That is okay. So I've been able to confirm that. So I'll do my check. I'll check the fluid. It's normal saline. It was started today at 8 a.m. It's to be discarded tomorrow. And the signature of the nurse that put in this is right here. So I'm going to follow the line, check the tubing. The tubing was inserted today and it's going to expire in 96 hours. And the signature of the nurse is there, so I'm going to follow it down. follow the line. I'm going to be checking for any occlusion, air bubble. So there seems to be some air bubble here. I'll fix that. Air bubble. Did I rest to see your end space? Yes. So I'm going to go to the site and palpate and check if there is any injury. If there's any inflammation, phlebitis, or patient feels pain in the site of the injury. Patient does not seem to feel that. So I'm going to wash my hands because I'm going to have contact with the patient now. So put on my gloves.
And then wash my hands. And ask.
So remember, I provide for privacy when I came into the room.
Okay, well, I will
Just put in that. So I'm going to trace the line back again, confirm that the side. Do you feel any pain or tenderness? Patient says no. And there is no swelling, and the site is clean and dry. And the dressing was done today, and so it's still okay. It's clean and dry. So I'm going to trace it back. No bubble. Through the line. Okay. It's not locked. Back. Confirm the expiration date. It expires in 96 hours. And the fluid is flowing. And the IV fluid expires in 96 hours. And we have normal saline running. And we have 10 ml per hour. So that's the second check. So I'm going to do the final third check. This is normal saline. I have it expiring in 24 hours. It was imputed today. The line was also imputed today. The tubing is imputed today and it expires in 96 hours. So I'm going to follow the line. And be sure everything is okay. Down, all good. To patient side. The hand, there is no swelling. Patient, do you feel any pain or tenderness? Patient does not feel any pain or tenderness. And it's all good. So now I'm going to go ahead to put in my right.
I just
Just, I have to come to
let me. I didn't do this. This was already done, by the way. No, I have. It is opened. I just grabbed that one. That one does have a
So Miss Fatima, do you feel any pain today? Patient says no, she doesn't feel any pain. Okay. So I'm going to take this right here. Right. So I already spoke to this being intact and uninspired, so I'm going to bring it up. And just put this here because I'm going to be accurate right here. Good. So the first thing I'm going to do is to lock this, clip it. Clipping this. I'm going to go. Okay. So I'm going to go ahead and spike it. Medication is intact, unopened, unexpired. So go ahead and spike it. Good. So now what I'll do next is to prime these through back fluid with this medication. Right? So I'm going to be inserting it right here. That port seems to be opened. It's not supposed to be. Since it's open, so what I have to do is to clean it for 15 seconds. Clean it for 15 seconds. Allow it to dry. And then I'm going to connect. So when I came, I already did focus assessment on my patient. I already did that. So I'm gonna go ahead and do the backflow right now by opening this. Trying my back now. Okay. So I got it all in. So I'm gonna go ahead and hang my line. I want to pause it first. That's good. So what I'm going to do next is to select the channel and put my medication. Okay. Secondary infusion. So I'm giving the Zithromycin, so it's here. I'm giving 500 milligram per 250 ml, which is why confirmation. I confirm that. So this is it. So I'm going to stop. And I stopped. It said I should confirm that it's unclamped, which I have done. I've unclamped it. So I can start. Now I'm going to bring my secondary line down so my primary line can run faster. So my secondary line is up. So I can start right now. So my fluid is running. I've confirmed it from there that it's running. And that is all. So your medication is running already. So what I'm going to do is I've already confirmed that my secondary fluid is running now. And I'll get the call light close to my patient. Do you have any question for me right now? Patient says no. Do you need anything from me? Patient says no. And then I will come back to see you in 15 minutes. Is that okay? I get a call light close to patient, close the door. And that is all. Thank you very much.